Yeah, I remembered.
You did.
You didn't say your thing, though.
I wasn't the one that wanted to say it this time.
That was Amy.
It was Amy wanted me to say it.
All you cool cats and kittens.
Good afternoon, all you cool cats and kittens. She wanted me to say it really, excited.
Yeah, you didn't. You failed.
No, I didn't.
Maybe next time.
No.
So, today, we're going to talk about eyeballs. Crystal loves eyeballs.
It's my favorite thing.
She gets really creeped out.
Yeah, I don't like eyeball things. That's the one thing in the field that I feel like just really creeps me out. I can do the abscesses and the goo and all that. It's fine. Yeah.
That's fine.
Love it.
Yeah.
Love it. But I don't like eyeballs. I never have.
I don't think there's anything that's like that bothers me. I don't think. Do I have anything weird?
You have a lot of
I have a lot that's weird. But things that
that
creep me out? I don't think so. So today we're talking about Crystal's favorite, which is eyeballs. So we're talking about some of the things that we do, what are the things that we see commonly, what are the different tests that we run, and just a little brief something about kind of the common diagnoses and how we treat them and all that. So
plus we do have a few questions.
We do have some questions
that we've got asked.
That Crystal won't tell me about ahead of time.
I won't.
It's like a fun surprise.
We're a little crooked. You didn't fix that. You always yell at me about the
I tried to fix it. It's just that setup. Oh, no.
I made it worse.
Whatever. It's fine. We'll just be crooked. Just watch it.
Yeah, just turn your phone a little.
It's okay. It's fine. So somebody comes in with an eyeball problem.
Mm-hmm.
What are we going to do?
Well, it depends.
Yeah?
Is that the only symptom that they have? Is something like they're squinty on their eye? Yeah?
Yeah, So
let's start with this. Well, we'll start with the story I have.
Okay, you have a story.
Yeah, because I already had in my mind kind of what I thought was happening when I got this call. So my aunt, I asked her before talking about her on the live television. But I always say that.
On the live television.
On the live TV. I'm a star.
That live TV that we do.
So she calls me and she's like, hey, Fluffy is, I know we use that name a lot, but that's actually the dog's name this time. Fluffy's eye, there's something wrong. She seems to be, real watery. She said that for a couple days, she had a hair or something on her eye. And she was like, oh, it's fine. She'll blink it out. It'll be fine. So she said a couple days went by, nothing really changed. Now her eye is real watery. And I'm like, well, she's a little bug-eyed, Shih Tzu mix. She probably has a scratch on her eye because her eyelids don't really close over her eyes all the way.
Yeah, because her eyes are this all the time.
So I'm like, well, she probably has a scratch on her eye. I'll go over and just see if I can figure out what it is before you go.
Yeah.
And so I go over there. She has a giant ulcer on her eye. It was a divot in her eye. And I was like, ooh, that's real bad.
That's nasty.
That's real gross. So, of course, I'm, trying to clean it up with, a little warm washcloth, trying to make sure that that's all that there is. And I'm like, yeah, you need to take her somewhere. This is more than what I can do anything for you. Took her to the vet. I'm like, she's probably going to need, some antibiotic eye drops.
Mm-hmm.
They may want to use some serum on her, which we'll get into.
Mm-hmm.
She may end up losing her eye. She didn't. She's doing better. She's healing. They're doing the serum. They're doing the eye drops. So she's getting better. Thank goodness. But yeah, so.
Yeah. Some of those could be wicked.
Oh, it was bad. It was one of the worst that I've seen.
Yeah.
Yeah, it was pretty
gross. Some eye issues, we don't really need to get to testing because it's super obvious like that.
Yeah.
So a lot of times if you, and the history and kind of the breed of the animal and the species helps kind of narrow down to what we might be looking like, what we might be doing. So when people call and they're like, hey, there's something wrong with my Shih Tzu's eye, well, best guess is probably going to be some kind of ulcer, just because we know, or your pug's eye or your bulldog's eye.
Especially if it's just one.
Yeah.
If it's just one eye that they're like real squinty or that
might
eye's
be
watering.
some discharge. Yeah.
Yeah.
So we already kind of have an idea from there, and some things we can tell just with the physical exam and just like looking with the light and tell what's going on there. For a lot of eye conditions, we do end up doing some further testing. So I brought props because I'm so fancy.
We had one, what was it, last week that we didn't think was going to have a scratch on the eye, and it turns out that he did.
Yeah, it was surprising.
We did that as kind of because there's certain eye medications that you can't use if there's a scratch on there, which is why if you already have eye medications at home, we still want to see them first.
Yeah.
Because for that patient, you had actually put on the treatment plan a steroid eye drop.
Because I was thinking it was just going to be like an allergic conjunctivitis or something along those lines, and so I was like, oh, this is probably what we're going to do, but let's just make sure that there's no scratch before we do this, because the steroid would make it way worse. So that would be why we do that, because sometimes some things are very subtle and we can't see them without the testing. So that's why. So when we do ophthalmic testing in animals, there's a lot of things that we do that are similar to what's done in people. Our patients are just a lot less cooperative. When I go to the eye doctor and they have you put your chin in the little thing, and I'm like, oh, wouldn't that be nice? I could just be like, can you just hold your head still for me and look straight ahead?
Just for a minute.
Try not to blink. That would be amazing. No, they don't do that. Ever.
Never.
So the first test that we start with is the Sherman tear test. And I don't know if I can make it so you can see this. So there's a little strip. It has a bunch of numbers on it and that little blue dye line that's there. So what we do with this is we actually, I'm going to take it out of the package, but it kind of hooks on the inside of the eyelid. And we leave it sit there for, depends, ideally a minute. We don't always get a minute. Some of them are doing this the whole time, and it's like, well, 30 seconds is going to be all it's going to do, or 10 seconds. So that little bit of dye that's there, what's happening is as the animal's eye is tearing, this paper kind of soaks it up, and it kind of comes up this little ruler thing that's on here, and it takes the dye with it, so it's easier for us to see. So we're measuring your pet's tear production. So what we're looking for with that is dry eye. So animals that have recurrent corneal ulcers, or some animals' eyes, you can look at them and you're like, that you can just see that it's dry. Like, it looks like a little raisin in there. That's wicked. But this would be how we test for tear production, testing for dry eye, or it's also called KCS. What does it stand for?
Keratoconjunctivitis sicca. Was that?
Yeah.
I said it right? Okay.
Yeah. I say Sika.
Sika.
But yeah, I mean, other than that, you did awesome. So that's the Sherman tear test, and so we'll do one in each eye. So checking for tear production, and
it's like a nice soft.
Yeah, it's
like a
thin.
soft paper.
It's a thin little strip. Like, it doesn't hurt them, and their tears wet it pretty much immediately. So it's not uncomfortable. I think it's just weird having something stuck in their eye. They don't understand why we're doing that.
Yeah.
So we do that one first because we don't want to have put any kind of drops or eye wash or anything else in the eye when we do this, because otherwise those drops are going to affect the measurement here. It'll soak up those eye drops too. So we'll do that first. And then I usually will do, this is the Fluorescein Stain. So this is a little strip. This has orangey yellow dye on it. I do this next. This is our test for corneal ulcers or scratches or whatever you want to call it. But basically, something is abnormal, like a scrape on the clear part of the eye, which is the cornea. So I'll add a little drop of eye wash to that and drop it in the animal's eye. For really squirrely animals, I'll rip off the end of that and put it in a syringe and drop it with a syringe if I think I'm not going to have really good luck dripping off the tip of this little slip of paper. But yeah, so that stain will stick to only abnormal portions of the cornea. So a normal healthy cornea, you'll see it pool along the eyelid. That's okay, that's fine, that's normal because that's just some pooling with the liquid that's there. But if they have like a scratch or an ulcer, it'll stick to that. And then it glows. So we're able to use a light to make it glow so we can see it, and it highlights that. And that's that dog that Crystal was talking about. That's how we saw that. Because otherwise, I mean, I didn't see any swelling anywhere. It was a very small little area, and it was like up kind of underneath the upper eyelid, so it was hard to see until we did the stain.
Yeah.
So
it's
usually
really pretty.
Yeah.
And she will turn any white dog yellow.
You know I like to make a mess.
I know that you do.
Well, and it stains, so it's just how it goes, unfortunately. So I do my best not to make a big mess. Contrary to what Crystal thinks, I don't try to make a mess. It's just how it goes.
You're just really good
Job
at
security.
That's right.
Fine. It's fine.
That's right.
So that's the second one that I do. Before I do this one, and actually this is like the exact same thing that they used on me at my eye doctor appointment this year, and it was really funny.
Did you do this the whole time?
I should have. I should have been like, no. So this little guy, this is a Tenometer. So this is for measuring the pressure inside the eye. And I was laughing because I mean, like I said, it's the exact same thing that they use for people. They just slap a different name on it. So this little part here is like a forehead rest for like lining it up on people. I was like, oh, it's so nice that that's useful to you because it doesn't work at all.
No.
They could have just taken this little part off for all the veterinary patients, honestly, because it never lines up correctly to do it that way. So what this has is there's a little probe that goes in this part, and it's a disposable one, so we just use one per patient. And so it's got like a little ball on it, and we line this up with the eye. We usually do a numbing eye drop first, although my eye doctor didn't do that for me, so I don't know. It was weird.
What?
Yeah, I don't know. Maybe we're not supposed to have to do the numbing drop with this, but I still do.
I would prefer that.
Mm-hmm. So this lines up with the eye. It's kind of finicky about like the angle. Like it has to be just right or it yells at me. So this one's like the trickiest thing to do too. Because it has to be lined up perfectly.
Yeah.
And if they're trying to hold the head still, you can't put too much pressure you can't put pressure on the neck or on the eyelids. That'll change the pressures in the eye. But this is a glaucoma test. So checking the pressure inside the eye, checking them for glaucoma. So if it's high, that's glaucoma. If it's low, that tells us something too, because there's an inflammation that can happen inside the eye that will actually bring the pressure lower than normal. So that tells us something too. So there's a lot of times that we'll do all three of these things, and that's what I call the ophthalmic minimum database. So that's our testing that we do when they come in outside of just the physical exam. So yeah, that's where we start. And then based on those results, hopefully we have a diagnosis. Not always. Sometimes we're like, oh, this is still really weird. It might end up sending you to like an ophthalmologist. But that's at least a starting point.
Yeah.
So let's talk about dry eye first. Because that was our first test, was the Sherman tear test. Let's talk about dry eye.
Okay.
How do we treat that?
They need some sort of lubricating drops for forever.
And
what's the other thing? Does it start with an F?
no.
Optimune.
Yeah, or tacrolimus, one of the two. So, that's an important point though, that it's forever. So dry eye cannot be cured. You don't do just like one round of medication and we're like, okay, we're good. No, it doesn't go away. It's something we manage. It's not something we cure. So yeah, lubricating eye gels, eye ointments, eye drops, whatever, are recommended, and then we'll also do a medication to stimulate tear production. So that's going to be our Optimune, which is cyclosporin, or tacrolimus, one of those two. And some animals need both if they're really, really bad. And so then we'll recheck their tear production after they've been on that for a period of time. We'll recheck them. Are they producing enough now? If yes, great. Like I said, that didn't fix it. It means the medication's working and doing what it should. So it didn't fix the problem. It's not cured. We can't stop it. But we know that that's a good dose for them. And then we just continue them on that forever and ever. And that's common in those little, like, buggy-eyed dogs, too. Yeah. The brachycephalic breeds, if you will. So the pugs and the Shih Tzus, they're prone to dry eye. For sure. And
Poor
like I said,
things.
you can usually tell. And it's usually, like, they'll come in and it's, like, thick yellow, green stuff. And it just, like I said, you can
Like
look at that.
sticks to
You
the
can
eye.
look at that eye and you can see that it's dry. It's wicked. It's
Oh, it
real.
makes my eyeballs hurt.
Yeah, I mean,
Oh, I
it's
can't.
uncomfortable. I mean, I don't wear contacts because I get a little bit of a dry eye. Like, so if I wear the contact,
You're a pug.
because I'm like a pug. So like I can wear contacts for a short period of time, like maybe a couple hours, but after that, like I can feel it, and it just it's so uncomfortable. So I can't imagine living every day of my life like that.
Yeah.
No.
No.
No. All right. So second one, so our second test that we do, like I said, it's fluorescein stains. We're checking for a corneal scratch or ulcer. How do we treat that?
Antibiotic eye drops.
Why?
Because we want to make sure that that area doesn't get infected. You taught me this earlier this year. It doesn't help with the healing of the eye. It helps to keep it from getting infected so that it can heal.
Exactly. So so the antibiotic eye drop's not necessarily doing anything to fix the ulcer itself. The eye will heal on its own in general in simple cases. But trying to keep it from getting infected and nasty, because then that'll cause all kinds of other things like melting corneal ulcers, which look exactly like they sound. So that would be a time that we would use serum. What is serum?
Serum, we draw blood from them, we let it clot, we spin it in a centrifuge, and we take that top part off.
The liquid part.
The liquid part.
So basically, we're spitting that sample so all the red blood cells separate from the liquid portion of the blood, and so then we just take that liquid portion and we use it as an eye drop. Do you know why? Do you remember?
Because it promotes healing. It's got fibrogen.
It has the fibrogen.
Shut up. What is it? I hate you. I'm leaving.
You love me. No. So the reason why
no.
corneal ulcer.
Wrong.
You're wrong. The reason why corneal ulcers melt or can melt has to do with infection happening there and certain
So mean.
enzymes. Certain enzymes that are produced by that bacteria that will cause basically like just melting of that corneal surface. So the serum actually contains things to kind of counteract those enzymes to keep it from melting. That's why.
There you have it.
So that's why. So that's why we're doing the serum. Again, it's not necessarily gonna fix anything. It's trying to prevent a problem. So like we saw a dog earlier this year that had a wicked scratch on her eyeball. It was super deep and it was probably from a cat, and I was like, ooh, if any ulcer is going to try to get infected and melt, it's going to be that one, and it's going to be bad. So we were really aggressive with that one. So she got serum and all of the antibiotics and everything. The other important thing to note when we have a patient with a corneal ulcer, they have to wear a cone. That's like probably like the most important thing. because it's uncomfortable. And so what do animals do when something's uncomfortable? They're going to rub. They're going to rub their faces on things. They're going to scratch.
Especially those little bug-eyed dogs.
Oh, yeah. I mean, they're all eyeball anyway. And so, of course, like, what do you think is going to happen? That's going to make it worse. And so it's definitely going to impede healing. And even if you don't see them doing it, they do it. So, cone of shame. And it has to be the cone of shame. It can't be one of, like, the inner tube things or, like, the white knot neck brace collar things. Those don't work. It has to be something that goes around their face so they can't rub and they can't paw. Because the inner tube, I mean, you can get a paw up around the little inner tube thing. You know what I'm talking about, like those blue ones.
What do they do?
They get a paw. Right? Do you just like it when I act it out? So, yeah, unfortunately, it has to be a cone of shame, and it has to be all day, every day. And it stinks. I know. My worst dog had a corneal ulcer not all that long ago, and of course, he was horrible with the cone. I mean, he's horrible all the time. McMurray is the worst. But so of course he's running into everything, including us, and it's obnoxious and,
I'm sure
terrible.
They know.
Yeah, I'm sure he did because he's awful. But yeah,
you're never gonna let your husband pick a dog again.
No, never again. I want a quiet senior animal that just wanted to be a couch potato and just hang out with me while I do crafts. Nope. We got a puppy.
Terrible idea.
So yeah, cone of shame. Must. So third test, like I said, is our tonometer. That's this guy. So checking for abnormal eye pressures. So we're looking for glaucoma. So glaucoma is an increased pressure inside the eye. That'll come from a couple different things happening. So there's normally fluid inside the eye in people and animals, everyone. And there's a normal balance that's happening there where it produces fluid and then there's a drainage system. And so if their eye is either overproducing fluid or the drainage system is clogged, now we're going to get too much fluid inside the eye and it's going to increase the pressure. That's when you're going to get that big bulging eye that's really red, painful. That's bad. That can cause vision loss because it'll affect their retina. And so that's why it's important to get it under control quickly. So test them, make sure that's what's going on, and then we start them on drops to reduce the pressure in that eye. Sometimes it takes a couple of different medications to really get that pressure down to where it needs to be. Sometimes we pick a good one straight off the bat. It just depends.
Straight away?
Straight away. I love that your child says it now.
I know. Yeah, for those of you that watch our videos, and I always make fun of her saying straight away, the other day my son was in his bedroom playing a game and he said something about, Mommy, when you do this, straight away. And I was like, where did you learn that? That's not something normal Americans say. I'm just going to throw that out there.
Well, he and I both say it.
Apparently he's 6, so maybe you taught it to him.
Maybe so. Maybe he's heard me say it. I don't know.
Maybe he's getting on the Facebook and watching our videos.
That could be. He does like to watch videos.
He does.
So eye drops for glaucoma. In really bad cases, there's surgery that can be done. Not here to open up the angle so that it can drain better. Sorry. But not here. We don't have the fanciness to do that.
Thank goodness.
What we'll end up doing in some eye cases is crystals. I am. I had too much salt for lunch. Is we will sometimes have to take eyeballs out. Crystal's favorite. I love your face right now.
Hate it.
So that's a time we'll do that if we have a condition that the eye is painful, and vision is either poor or absent, and there's no fixing the pain. Time to just take the eye out. And I know a lot of people will be like, "Oh, that's dramatic," But, in cases like glaucoma that aren't well controlled, despite medication, and they may or may not be blind to that eye already, but that eye is very painful. So we will take the eye out. I've done it for corneal ulcers that we're not healing as well. So it's not, obviously our first choice. We try other things before that, but sometimes that's really the kindest thing that we can do.
Mm-hmm. And even though I hate it, it's really gross. But most of the time, they're much happier even before they leave.
Mm-hmm.
I mean, you can just tell.
Yeah.
And if you guys have ever had a migraine or something where you can feel the pressure behind your eyes,
Mm-hmm.
I can only imagine it's at least 10 times worse than that.
Yeah.
It's awful.
It's awful. And so they'll act like new dogs after that.
Mm-hmm. Especially if they couldn't see in it before. The only reason you're keeping it is for aesthetic purposes.
Right. Which usually that eye looks pretty nasty too. So it's not like it really looks better.
Yeah.
They're better off just looking like they're winking at you.
I hope you never need to lose an eye.
Wow. So yeah, they heal so darn quickly, like less than a week, and they're basically healed. So they do really, really well after that. So some other eye surgeries that we'll do have to do with correcting some different congenital issues. So one of them is called Entropion. What is Entropion?
So when the eyelid rolls into the eye.
Yeah. And so that's, as you can imagine, not as big of a deal on our faces, maybe. I mean, we do have eyelashes, though. But on a furry-faced animal, what's that going to do? There's hair rubbing on that eye all the time. So chronic corneal ulcers or recurrent corneal ulcers are going to happen, and that eye hurts.
We've done a couple of those lately.
Yeah.
We did one yesterday.
Yeah, for the shelter. So that's something they're typically born with it. It can develop a little bit later, but
maybe it's Maybelline.
Maybe it's Maybelline?
He said typically they're born with it.
Oh, I was like, huh?
I'm on something today.
Entropion. You would have enough caffeine.
Maybe.
So that's Entropion. So we actually will do a surgery that we take a little wedge of skin out from below the eyelid. It's a little crescent-shaped incision and stitch it together, and it helps roll that eyelid out where it belongs. So it's not rubbing on the eyeball anymore. Mm-hmm. And yeah, speaking of that cat yesterday, he is up for adoption at St. Charles Pet Adoption Center. He's a big, fat head, orange cat, and he is amazing. So sweet.
God. He was
so sweet. So if anybody's looking for a cat,
take him home bad, but I don't even want the cat I have half the time. But no, he was really cute.
Cool.
Are you gonna post that picture?
I need to. Yeah, I need to post that picture. He was a doll. What a nice kitty.
He was
so good.
He was.
He just wanted scratches and what he'd clearly
he's
been
the pit bull version of a cat. If there was a pit bull that was a cat, it would be him.
Yeah. And he's very, he's obviously had been intact and outside for a while, so his little ears were beat up, and his little tongue had like a little chunk taken out of it, but, oh my God, he's the sweetest little guy. So yeah, if you need a cat, go check him out. He's awesome.
We named him Fred.
We didn't know what his name was, so we named him Fred. So that's Entropion. There's an opposite problem, so you'll see what's considered normal for the breed in like the Bassets. I can't speak. Basset hounds. So ectropion is when it rolls out or it kind of droops. Like I said, there's normals for that in certain breeds like Basset hounds, bloodhounds. But it can also happen in other breeds of animals. And so if that happens, the problem is they have a hard time sometimes with keeping their tears on their eye, so it'll lead to some dry eye just because of that. So we need to just kind of tighten up that lower eyelid. So we'll take out a little wedge section and kind of shorten it, because basically the problem is the lid's too long. So we'll just tighten it up. Straight away. So those are a couple of common eye surgeries that we do.
Too much caffeine.
Maybe that's
I haven't had enough. You've had too much.
We need a better balance.
Yeah.
The third eye surgery that we'll do is called cherry eye repair. What is a cherry eye?
Cherry eye is where basically like the third eyelid is like protruding out. It's like
It's not the
popping
eyelid
out.
itself.
Well, it's like at the tear duct? The duct in
The
there?
gland.
The gland.
It's actually the gland. So the technical term for that is prolapse of the gland of the third eyelid. So in dogs and cats, they have 3 eyelids. We only have 2. So they have upper and lower, just like we do, and then they have a third eyelid that comes from the corner of the eye and will kind of come up like this. And so you'll see it if their eye is painful. That third eyelid will come up. It looks pink, kind of like the inside of their other eyelids. It's that same color. And so like if their eye hurts or if they're dehydrated, that might come up. There's also some neurologic issues that can happen and you'll see it more prominently. Or some animals, just because of the way that they were born and formed, sometimes it's more prominent in some dogs than others. You don't see it as much with cats. It's not as big of an issue with them, but in certain dogs, certain dog breeds, it can be more prominent. But that has a gland down in the corner of their eyes that you don't normally see. Sometimes, for whatever reason, it slides out of where it's supposed to be and is up into the third eyelid. And so then it like bulges out. It'll look like a bulgy red spot in the corner of the eye. And that's called cherry eye. So the problem with just leaving that, other than just it looks ugly, is that will cause damage to that gland. And that gland is very important for tear production. So if we leave it there, we can have damage to that gland, and then later in life they can have dry eye. So it is recommended to surgically correct that, and we basically kind of tack it back down to where it's supposed to go. We don't remove that gland. There are places that do. They should not.
Isn't it like malpractice now?
Well, I don't know, but I've had that question before. Well, my old vet did it, and I'm like, okay, well they shouldn't have, so that's cool. Because again, it's important for tear production. You take that out, what's going to happen? They're going to get dry eye. So that's why we don't just take the gland out. Because there's times where when we tack it down, sometimes that surgery does fail and they have to have it a couple of times, which stinks. And I completely understand that people would get frustrated with that. But we can't just take the gland out. That's not good. No bueno.
Sure.
So, what else? Are there any other eyelid? You want to go through your questions?
Yeah, we can do that. Let's see. Eyelid masses.
Mm-hmm.
That's one we haven't talked about.
Yes, they occur.
Yes, they are. Wow. Okay. Clearly, that's not something let's talk about.
Eyelid masses, sometimes they're just cysts. And they have little tear glands kind of along their eyelid too that can cause cysts, kind of like a sty in a person. Other times it can be something that's cancerous. So we may or may not suggest, depending on the appearance, we might suggest removing it. Which a lot of times involves taking a little wedge section of the eyelid to be able to get the whole thing. Is that good? Is that better?
See you for that.
Yeah.
My Jason face. Okay, so these were questions we got from some other people about eye things.
Mm-hmm.
Should I try to remove debris from my pet's eye myself?
You certainly can, depending on what it is. I mean, if it's something like stuck in the eyeball, I saw one of those this summer. That was super fun. Don't do that. But you can, if there's just like some discharge or drainage, just like a warm, damp washcloth or paper towel is totally fine to wipe around the eyelids there. That's cool. If it looks like your animal has like hair or some kind of nonsense just sitting on the surface of the eye, you can use some eye flush. We just use saline eye wash here, and you can just flush. Hopefully it comes out. If it doesn't, maybe that's the time to come see us, because maybe there's something more going on. Like maybe it's a flap of the corneal, like here, let's talk. So maybe it's kind of attached there, and that's not supposed to come off. But yeah, you're not gonna hurt anything really by doing just a little bit of a saline eye wash.
Because we've had things come in where it's like stuck under the eyelid.
Mm-hmm.
Remember that hunting dog that had, it was
Yeah.
like a piece of seed or something stuck behind its eye. That was gross.
Yeah, that was gross.
Are there eye drops made for dogs, or do they use human eye drops?
I think most of the ones that we use are probably for both. Optimune, I don't know that they use in people, so that's one of the dry eye treatments. I don't think that that's used in people for anything. Well, I take that back. It's not that brand, but I think Restasis is the same thing. I think it's cyclosporin as well. So I think it's just not that brand. And I think last I looked, it was quite a bit more expensive, but it's been years
Usually
now.
is.
So usually is. Because it was a human labeled product. It wasn't a generic version. So I think it was quite a bit more expensive, but technically it is cyclosporin. So yeah, there's a lot of crossover. And so some of the more specialized eye meds, like some of the glaucoma ones, we don't necessarily carry every single one of those. I have like one in stock. And so if that doesn't work, then we'll typically script it out to a human pharmacy. So yeah, a lot of the ones that we get can be found there.
My dog has watery eyes. Could that be from allergies?
Yeah, absolutely. And if it's just clear, watery, teary stuff, that probably is what's going on.
Especially if it's in both eyes.
Especially in both eyes. Although I've seen allergies in just one.
Yeah.
Just like we can see ear infections in just one ear that are due to allergies. I don't know why. It just is. But yeah, so it's a good idea, especially if it's something that the eye looks red. Get it checked out, make sure it's not something else going on. If the eye doesn't look red, and it's just some clear watery stuff, could be either allergies, could be that they have a clogged tear duct. So they have a tear duct that runs from the corner of their eye here in the center down to their nose. That's a normal drainage system for the tears that they produce. If it gets clogged for whatever reason, or maybe like it just never formed properly to begin with. I had a Cocker Spaniel that had that. And so he was just always like really teary. So big thing with that is just keep everything, try to keep the area underneath the eye kind of dry as much as possible. I like wipe it a couple of times a day, just so it's not irritating the skin, because I've seen where they get like the big eye boogers, or just due to the chronic wetness, it causes like a skin infection there, and that's really uncomfortable.
Yeah.
So,
or it just builds up and builds up and builds up, and then all underneath is like raw.
It's raw.
You go to
so
we go
painful.
to take it off, and sometimes we have to shave that area, and most of the time it looks worse than before we did it, but it really needed to come off to get that dried under there.
It's wicked.
Yeah, they've had multiple times where
sometimes it gets kind of
It's
stinky
gross.
and infected and nasty
it
stuff.
might bleed a
And
little.
that's the important thing to know too. I think for a lot of people, dog and cat tears have a protein in there that will cause discoloration of their hair, especially in those white or light colored animals. So if you see them with like that reddish brown streaky stuff there, that's just tear staining. It's not blood. Like a lot of people will be like, oh God, it's blood. It's not. It's just normal tear staining, and it's cosmetic. It's just cosmetic. It doesn't really hurt anything, so I wouldn't stress over it. It's okay. If you see blood coming, you will know that it is blood for sure.
Especially if you have a white dog.
Yeah.
Last question. When would you remove an eye? We talked about that a little bit.
We talked a little bit about that, but yeah, a big thing is going to be if they have a painful condition that's not able to be treated for whatever reason, because maybe our treatments are failing, or maybe the animal won't allow them. We've had one of those. Those would be times that we'd remove it. It needs to go out. And they do just fine. Just like animals that are blind, a lot of times they can compensate. They can figure things out, and if they get like cataracts or something, we don't really talk about cataracts, but that will block their vision and can make them blind. They usually do just fine. Just don't move the big furniture. Sometimes they'll have some trouble going down, like going downstairs. Up is usually not a problem, but down's a little scarier because they're kind of stepping out onto nothing. But yeah, they use their other senses. They figure it out. They bounce around for a little bit, but they figure it out. They do have some kind of, I can't remember what it's called. I was talking to somebody about this. It's like little like halo thing that I think is like, it comes off with like they put a harness on them or something, and it has like this bar, like kind of like a half a hula hoop looking thing, and so
they can't like, run into
so they don't run
faces.
into stuff. Yeah, for some of the blind animals.
Cool.
Like I said, I don't remember what the name of that is. I'm sure if you Google it, you can find something. But
Interesting.
yeah, it's a clever idea. So so blindness doesn't usually cause a big issue for most animals because let's be honest, they're not having to go out and hunt for their food.
Right.
Their noses can find that food bowl just fine. They can find their bed just fine.
Mm-hmm.
So yeah,
They go to the bathroom
it
anywhere.
doesn't.
So.
And once they get over that initial adjustment period, if it's something that did come on suddenly, they're okay. They're okay. They don't need their eyes. If those eyes are causing them issues and they're causing them pain, they're better off without them. Whether it's one or both, it doesn't matter. They don't need them. They're okay.
I think it's harder for us most of the time.
Yeah. Yeah, it's just to see it because it does look different. It looks a little funny, but they're more comfortable.
I pet sit a dog who doesn't have either one of his eyes.
Yeah.
And he does great.
Mm-hmm. Yep. They
Yeah.
do. They do fine. Like I said, there's an adjustment period, but they do fine.
Mm-hmm.
So.
He wanders around my house and, well, as soon as he gets there, he pees on things. But other than that, he's just like,
I don't think that's because he's blind, though.
no, it's not.
Oh, goodness. Yeah. Is that all your questions?
Yeah, that was it.
Wow, we did good.
Yeah.
Awesome.
I mean, it's been 41 minutes,
well,
I'm
yeah.
sure.
Like I said, it's
Nancy's probably the only one
it's a
watching
long
us still.
topic. That's okay. We love her.
We do.
I hope she's feeling better.
I know. I keep meaning to text her
Yeah.
and ask, and I just keep forgetting.
Yeah.
So, if it's you, Nancy, I'm thinking about you.
So maybe next week I think we're going to talk about ears.
Oh, okay.
Because we're doing a super fun experiment we'll tell you about next week.
Oh, yeah.
Because we're weirdos again. But so maybe we'll talk about ears next time. And if you think of any questions, let us know. Otherwise, we'll see you next week. Bye.